If you're over 60 and taking pills every day, there's something you need to hear right now. Because I've sat across from patients who did everything right, took their medications exactly as prescribed, and still ended up in the emergency room with a heart attack or a stroke. And what I'm about to tell you might surprise you. Sometimes it wasn't their condition that put them there. It was the combination of pills they trusted. Before we go any further, if you care about your health and want clear, honest medical guidance like this, take a moment to like this video and subscribe. It helps more people hear information that could truly protect them. Now, let me speak to you as a doctor who has seen this happen too many times. Most people don't realize that as we age, our bodies change in quiet but powerful ways. Your liver slows down, your kidneys don't filter as efficiently, your blood vessels become more sensitive, and yet the number of medications often increases. 1 pill becomes 3, 3 becomes 7, and suddenly, your body is managing a chemical load it was never designed to handle. What concerns me most isn't just the number of pills, it's how they interact. You may be taking something for blood pressure, something for pain, maybe a pill to help you sleep, and another for cholesterol. Each one may be appropriate on its own, but together, they can create hidden stress on your heart and brain. I've seen patients walk in feeling slightly dizzy, just a little off balance, maybe more tired than usual. They thought it was aging, they thought it was nothing. But those subtle symptoms were early warning signs, signs that their body was struggling to cope with the medications in their system. And here's the difficult truth. These warning signs are often ignored until something serious happens. What I'm about to share with you in the next few minutes could help you recognize those risks early. Not to scare you, but to give you the awareness most people never receive until it's too late. Because your health after 60 isn't just about what you take. It's about what your body can safely handle. There's a moment I remember very clearly. A patient in her late 60s sat in front of me and said, "Doctor, I take everything exactly the way I'm told. So why do I feel worse?" And that question, it's more common than you might think. What I'm about to tell you might surprise you. Sometimes the issue isn't that you're doing something wrong. It's that your body has changed, but your medications haven't adapted with you. As we age, the way our body processes medication becomes slower and less predictable. A pill that once worked smoothly in your 40s or 50s may now stay in your system longer than expected. That means its effects can become stronger and sometimes more dangerous. Most people don't realize this shift is happening. They assume that if a medication helped them before, it should still feel the same now. But I've seen this happen too many times. A perfectly standard dose suddenly starts causing lightheadedness, unusual fatigue, or even sudden drops in blood pressure. And here's where it becomes concerning for your heart and brain. Certain medications, especially when combined, can lower your blood pressure just a little too much, not enough to immediately alarm you, but enough to reduce blood flow to vital organs. You might feel slightly dizzy when you stand up. Maybe your vision dims for a second. Maybe you feel unsteady walking across the room. It seems small, easy to ignore, but those brief moments can increase the risk of falls, and more importantly, they can signal that your brain isn't getting the steady blood supply it needs. Over time, this can place stress on your cardiovascular system and may contribute to serious events like strokes. Another hidden issue is how some medications affect your heart rhythm. You may not feel it directly, but inside, your heart could be beating slightly irregularly. And when combined with dehydration or other medications, that subtle irregularity can become something far more dangerous. I want you to understand something very clearly. This is not about fear, it's about awareness. Because when you notice early signs, like dizziness, unusual tiredness, or a sense that something feels off, your body may be trying to tell you something important, and listening to that signal could make all the difference. I want to talk to you about something that many people over 60 rely on almost every single day and rarely question: pain relief. What I'm about to tell you might surprise you. Some of the most commonly used pain medications, especially those taken for joint aches, back pain, or headaches, can quietly place stress on your heart and blood vessels when used regularly over time. I've seen this happen too many times. Someone has knee pain or stiffness in their lower back. They reach for a pill they've trusted for years. It helps at first. So they take it again the next day, and then the next. Slowly, it becomes part of their routine. But most people don't realize certain pain relievers can affect how your blood flows, how your kidneys function, and even how your blood pressure behaves. Some of these medications may cause your body to retain fluid. You might notice your feet looking a little more swollen than usual, your shoes feeling tighter by the end of the day, or a subtle weight gain that doesn't quite make sense. It feels harmless, but inside your body, that extra fluid can increase the workload on your heart, and when your heart is working harder than it should, day after day, it can gradually raise your risk of serious cardiovascular strain. There's another hidden layer to this. Some pain medications can interfere with how your blood clots. In certain situations, this may increase the risk of bleeding. In others, especially when mixed with different prescriptions, it may contribute to imbalances that affect circulation in ways people don't expect. And here's where it becomes even more important. Many adults over 60 are already taking medications for blood pressure, cholesterol, or blood thinning. When pain relievers are added on top of that, without careful monitoring, it can create interactions that the body struggles to manage. You may not feel anything dramatic right away, just a little more fatigue than usual, maybe a mild headache that lingers, a sense that your energy isn't what it used to be. These are the kinds of signals people often dismiss, assuming it's simply part of aging. But your body is rarely silent without a reason. I'm not saying you should never take pain medication, not at all. When used appropriately and under guidance, they can be very helpful. But what I am saying is this: routine, long-term use without regular review can quietly increase risks that many people are completely unaware of. And recognizing that pattern early can help you protect your heart in ways you may not have considered before. There's another group of medications I want you to pay very close attention to because they often feel harmless. In fact, many people don't even think of them as serious medications. Sleep aids and anti-anxiety pills. I understand why they're used. Sleep becomes lighter as we age. Worries can feel heavier. Nights can feel longer. And when you finally find something that helps you rest, it feels like relief. But what I'm about to tell you might surprise you. These medications can have a deeper effect on your brain and body than most people realize, especially after 60. I've seen patients who started taking a mild sleep aid occasionally, just once in a while. Then it became every night. Then, over time, they began to feel more forgetful during the day, slightly groggy in the morning, a little slower to react. They didn't connect it to the medication. Most people don't realize that certain sleep and calming medications can linger in your system longer as you age. Instead of wearing off by morning, they can still be active in your body the next day. That lingering effect can dull your alertness, slow your reflexes, and affect your balance. And here's where the real concern begins. When your balance is even slightly affected, your risk of falling increases, and falls after 60 are not minor events. They can lead to serious injuries, long recovery times, and in some cases, complications that affect the heart and overall health. But it doesn't stop there. Some of these medications can also influence your breathing and heart rate. When combined with other prescriptions, especially those for blood pressure or pain, they can amplify each other's effects. This can lead to excessive sedation, lower oxygen levels during sleep, or subtle strain on the cardiovascular system. You may not notice it happening. You might just feel more tired during the day, less sharp, maybe even a little disconnected. And it's easy to blame age or poor sleep without realizing the medication itself could be playing a role. I want you to hear this clearly. Needing help with sleep or anxiety is completely valid. There is no shame in that. But the solution should always be carefully monitored, especially as your body changes. Sometimes, small adjustments, like reviewing dosages, timing, or even exploring non-medication approaches, can make a meaningful difference in how you feel. Because your mind, your balance, and your heart are all connected in ways that are easy to overlook until those connections start to show signs of strain. Now, there's another category of pills that many people over 60 are told they may need, and in many cases, they truly do help when used correctly. Blood thinners. And I want to be very careful and very clear here. These medications can be life-saving when prescribed for the right reasons. They are often used to help reduce the risk of clots that could lead to heart attacks or strokes. But what I'm about to tell you might surprise you. When they are not closely monitored, or when combined with certain other medications, they can create risks that are easy to miss. I've seen this happen too many times. A patient comes in feeling more tired than usual, maybe a little weak. They mention occasional dizziness, or they notice bruises appearing more easily on their arms or legs. Small things, easy to ignore. But those signs can sometimes point to something deeper, that the blood may be thinner than the body can safely manage. Most people don't realize that the balance with these medications is very delicate. Too little, and they may not provide the protection you need. Too much, and they can increase the risk of internal bleeding, which isn't always obvious right away. And here's where it becomes even more important. Certain over-the-counter medications, especially common pain relievers, can interact with blood thinners in ways that increase bleeding risk. Even some herbal supplements, which many people assume are completely safe, can affect how your blood clots. You might not feel anything immediately, but over time, small internal changes can build up. A slow bleed, a drop in iron levels, a feeling of fatigue that seems to come out of nowhere. And because it happens gradually, many people don't connect it to their medication at all. There's also another hidden concern. If the balance shifts too far and your body becomes prone to bleeding, even a minor fall or bump can become more serious than expected. And as we talked about earlier, some medications can already increase the risk of falls. When these factors combine, the situation becomes more complex. I want you to understand something important. This is not about avoiding necessary treatment. It's about awareness and regular monitoring. If you're taking a blood thinner, your doctor should be checking how your body is responding, and you should feel comfortable asking questions about interactions, about symptoms, about anything that feels different, because your body often gives quiet signals before something becomes serious, and paying attention to those signals could help you stay one step ahead. There's one more pattern I want you to become aware of, because it's one of the most overlooked risks I see in people over 60. It's not just one pill, it's the combination. What I'm about to tell you might surprise you. Many serious health events are not caused by a single medication, but by the way multiple medications interact inside the body over time. I've seen this happen too many times. A patient is under the care of different doctors, one for the heart, one for joint pain, another for sleep, maybe another for blood sugar. Each doctor prescribes something appropriate for their area, but no one steps back to look at the full picture. And slowly, the list grows. 5 medications, 7, sometimes more. Most people don't realize that with every additional pill, the complexity increases. Your body isn't just processing each medication individually, it's managing how they affect each other. Some may amplify effects, others may cancel each other out, and some can create entirely new risks when combined. One of the most common issues I see is something called stacking effects. This is when multiple medications share similar side effects. like lowering blood pressure, causing drowsiness, or affecting balance. On their own, each effect may be mild, but together, they can become significant. You might feel unusually weak one day, or notice that standing up makes you feel lightheaded more often. Maybe your heart feels like it's racing at times, or slowing down unexpectedly. It can feel unpredictable. And because these symptoms come and go, many people brush them off. They assume it's just part of getting older. But your body is trying to adjust to a complex chemical environment, and sometimes it struggles to keep everything in balance. There's also the issue of timing. Taking certain medications too close together can change how they are absorbed or how strongly they act. Even something as simple as when you take your pills, morning versus evening, can influence how your body responds. I want to gently encourage you to think about this, not with fear, but with curiosity and awareness. When was the last time all your medications were reviewed together as a complete picture, not just individually, but collectively? Because sometimes small adjustments, removing an unnecessary medication, changing a dose, or spacing them differently, can reduce strain on your heart and body in ways that make a real difference in how you feel. And the truth is, many people don't discover this until after something serious happens. But you don't have to wait for that moment. I want to leave you with something that may be the most important part of this entire conversation, because it puts control back into your hands. Your health after 60 is not just about following instructions. It's about understanding your body well enough to ask the right questions. Most people don't realize this, but one of the most powerful things you can do is simply pause and review. Not in a rushed appointment, not as an afterthought, but intentionally. I've seen this happen too many times. People assume that once a medication is started, it's meant to continue forever. But that isn't always true. Your body changes, your needs change, and sometimes what helped you 5 years ago may no longer be necessary in the same way today. What I'm about to tell you might surprise you. Many patients feel noticeably better, not because they added something new, but because they carefully adjusted what they were already taking under proper medical guidance. Maybe a dose was slightly too high for where their body is now. Maybe 2 medications were doing similar things without anyone realizing. Maybe a side effect was quietly affecting their energy, their balance, or even their heart. And once those small adjustments were made, they felt clearer, stronger, more stable. But here's the key. This should never be done alone. I need you to hear this clearly. Never stop or change a medication without speaking to your doctor. The goal is not to remove what you need. The goal is to make sure everything you're taking is truly working for you, not quietly working against you. Start by asking simple, powerful questions. Do I still need this medication? Is this the right dose for me now? Could any of these be interacting in ways we should review? These questions are not challenging your doctor, they're partnering with them. And your awareness matters more than you think. Pay attention to your body. Notice small changes, your energy, your balance, your sleep, your clarity. These are not random, they are signals. And when you listen early, you give yourself the chance to act early. Because the truth is, protecting your heart and your brain isn't just about avoiding danger. It's about staying informed, staying engaged, and staying one step ahead. And sometimes, that step begins with simply asking, is everything I'm taking still right for me?